Bismillahirrahmanirrahim. I am Dr. Ramesh Kumar from the Department of Pharmacology, once more. We start with the name of the Allah, the most beneficent and most merciful. Now, topic for today or this lecture is the migraine, which is commonly known as Aadhe Sar Ka Dard, Sar Ka Dard. So, topic for today's class the migraine. Migraine. It has been proved that globally, headache is the most commonest neurological disorder in the world. And it is also mentioned that every person during his lifetime should be suffer from this headache, not from the migraine, but the headache. So globally, the headache is the most commonest neurological disorder in the world. Headache can be different type, like headache can be due to the migraine, headache can be due to the tension, or maybe headache due to the depression. So tension headache, depression headache, or cholesterol headache, and the migraine headache can be occur in the individuals. But related the other related factors or causes which can be cause the headache, they can be the sinusitis, any head injury, hypertension, dental disease or infection, ocular disease or infection, intracranial lesions, cervical spondylosis, or the temporomandibular joint dysfunction. They can be also produce the headache, whereas our topic today is there is a chronic headaches due to the migraine, tension, or cholesterol headache. If we compare these three related the migraine, cholesterol headache, and the tension type headache, in the migraine and tension family history is positive, whereas the cholesterol family history is negative. Whereas it has been observed that whereas it has been observed that the migraine is more common in the females, and the tension headache is also more common in the females than the males, whereas the cholesterol headache is more common in the males. In the females, it has been said that one of the cause of the migraine is that there's a disturbance in estrogen progesterone level. Females which are taking the oral contraceptive, they can be frequently faced with the migraine type of the headache. Whereas the difference between the migraine, cholesterol headache, and the tension headache onset is variable. Whereas the cholesterol headache usually occurs during the sleep, whereas tension headache or depression headache occur under the stress condition. Related to the location of the headache, it is a unilateral in the migraine case, behind around the eye in the case of the cholesterol headache, and bilateral pain around the head in the case of the tension headache. Just like this is a type of the cholesterol headache, this is a type of the tension headache, and half head pain or headache, this is a type of the migraine. Related to the characteristics of the pain, pulsatile tap and throbbing type occur in the migraine, where sharp, steady, and exuberant can occur in the cholesterol headache, where a dull, persistent, tightening headache pain occur with the tension type. Related to the duration of the headache, in the migraine, headache remains from 2 to 74 hours per episode, whereas the cholesterol has a shorter duration option, round about from the 15 to 90 minutes. where the tension headache can be, depending upon the severity of the depression of the from 30 minutes to the 7 days, where the associated symptoms or CNS symptoms along the migraine can be visual era, sensitive to light, sound, pale facial appearance, and nausea, vomiting can be present with the migraine type of the headache, where the color shade, unilateral bilateral sweating, facial flushing, nasal congestion, leg region, blood changes can be occur with the color headache. Whereas in the tension type of headache, mild interns to light and nausea and anorexia can be occur, but typical sign of the nausea and vomiting is related with the migraine type of the headache. Migraine can be divided into two main. One is a classic migraine, means migraine with a CNS involvement, neurological involvement. The headache preceded by neurological symptoms or era, which can be visual, sensory, and can cause a speech or motor disturbance, photophobia, phonophobia, disturbance the visual field, myopia. These type of the condition can be occur with the classic type of the migraine in which the neurological symptoms appear, and that is called the migraine with the era. Another type of headache, which is called the common headache, without the involvement of the neurological, and severe is a severe unilateral pulsatile headache, typically lasts for 2 to 74 hours, aggravated by the physical activity, accompanied by the nausea, vomiting, photophobia, and the phonophobia. Related to the pathophysiology of the migraine. Related to the pathophysiology of the migraine. Migraine involves the trigeminal nerve distribution to the intracranial and extracranial arteries. Intracranial and extracranial arteries. These nerves release a peptide neurotransmitter, especially calcitonin gene-related peptide, which is a powerful vasodilator. Also, substances P and neurokines are involved in the pathophysiology of the migraine, but it is believed that there's a most known the calcitonin gene-related peptide, which is a powerful vasodilator, is a cause of the migraine. In other words, simply we can say that vasodilatation of the intracranial extracranial arteries can be lead to the migraine. When dilatation of the arteries and extravasation of the plasma and plasma proteins occur in the perivascular space, which can lead to the edema, and edema lead to the mechanical stress. Edema causes the mechanical stress, which may be immediate cause of the activation of the pain, nerve endings, and pain associated with the temporal arteries. Pain associated with the temporal artery. Therefore, one of the way of the management of the migraine is that we apply the pressure on the both sides of the temporal arteries for 2 to 3 minutes, which can also give relief to the patient of the migraine headache. That's a non-pharmacological management of the migraine headache, to apply the pressure on the temporal arteries, both sides, and keep for 3 to 4 minutes, which can decrease the flow of the blood and can lead to comfortness to the patient with the migraines. Related to the management or treatment of the one treatment is by using the drugs. Second, I already told you to apply the pressure by the thumb or fingers on the both sides of the temporal arteries. Second one is the rest of the patient, to avoid from the any physical activity, avoid from the noise, avoid from the sun rays, and patient should try to go to the bed and take the rest. That is part of the management of the migraine. Along with that, we can use the drugs of the different group of the drugs, which can be give benefit in the management of the migraine. Their mechanism diverse, but the established drugs which can be used for the management of migraine, they are synthetic 5-hydroxytryptophan agonist or serotonin agonist, especially the tryptophan group of the drugs, tryptophan family of the drugs. Second one is an ergot alkaloid, which is used for the management of migraine. These are the special drugs which are used for the management of migraine. Third one is the beta blocker. Fourth one is a non-steroidal anti-inflammatory, non-specific, non-steroidal anti-inflammatory drugs also used for the management of migraine. Fifth one is the anti-seizure drugs or anti-epileptic drugs. They are used for the management of migraine. And sixth one is the tricyclic antidepressant drugs. They are so helpful in the management of the migraine because tricyclic antidepressant drugs increase the level of the serotonin in the brain, and it is said that serotonin is also a protein vasoconstricting agent, which can give relief in the patient of the migraine. And another drug is a calcium channel blocker. Along this group of drugs, some other drugs, they are also used in the management of the migraine, like the phenobarbital. They can be used like the skeletal muscle relaxant can be used, like the botulinum toxin can be used for the management of the. Mainly the drugs are the synthetic 5-hydroxytryptophan agonist, which is called the tryptophan group of the drugs. Treatment of the migraine can be prophylactic and can be given acute treatment. In acute treatment, mainly the tryptophan group of the drugs, elmotriptan, sumatriptan, naratriptan, zolmitriptan, froatriptan, rizatriptan. These are the drugs which can be given in the acute treatment along the ergotamine, tartrate, dihydroxyergotamine, and non-steroidal anti-inflammatory drugs. They are effective in the acute attack of the migraine. Along with that, also the anti-emetic drugs. If patient feels the nausea, anti-emetic drugs also give a very good result in the case of the acute attack of the migraine along the rest. Whereas for the prophylactically, methotrexate acid can be used, beta blockers can be used, especially the prototype of the beta blocker, that is a blocker. Calcium channel blocker can be tried, tricyclic antidepressant can be tried prophylactically for the management of the migraine. So the drugs which are used for the management of the migraine are the tryptophan group of the drugs. This is the list of the tryptophan group of the drugs. Elmotriptan, alotriptan, fluoroatriptan, norvatriptan, rizatriptan, sumatriptan, zolmatriptan. These are the drugs belong to the group of the tryptophan group of the drugs. Another group of the drugs which is specific for the management of the migraine is the dihydroergotamine and ergotamine tartrate. There is another group which is all the NSAIDs, already discussed in the previous class. Intermittent networks are used along the other drugs, anti-conversion or anti-epileptic drugs, beta blockers, calcium channel blockers, and tricyclic antidepressant drugs. They are used for the management of the migraine. Different group of the drugs. These are the serotonin agonists. Tryptophan are selective agonists for the 5-hydroxy, 1T, and 5-hydroxy tryptophan 1T receptors. So, tryptophan group of the drugs is acting on the serotonin 1T receptor and serotonin 1T receptor. And tryptophan group of the drugs are very effective in the treatment of acute migraine headache. Related the treatment group of the drugs, sumatriptan is absorbed having the less priority means about the 15% priority, whereas the other is the one. So lowest priority of the tryptophan group is the sumatriptan, whereas related the half-life of the drug, furovatriptan has the highest half-life, whereas the narvatriptan has the intermediate half-life, where the rest of the tryptophan group of the drugs like sumatriptan, prazotriptan, zolvatriptan, vellotriptan has the shorter half-life, that is 2 to 3 hours, whereas the longest half-life is the 25 hours of the provartriptan. Related to the sumatriptan, it is the first line drug for the management of acute drugs and the prototype drug of this group treatment. Sumatriptan is a secret of migraine headache. It is a serotonin, mainly acting on the serotonin 1D receptor. It is available in the market for the oral use, subcutaneous use, or for the nasal spray. It has a shorter duration. It is half-life of 2 to 3 years, but it is also the expensive drug. It is also the expensive drug. Whereas zolmatriptan is available in the oral and the nasal spray form, not the injection form. With all other rest of the drugs like Zizwa, tryptin, furovatriptan, naratriptan, they are available for the oral use only. Onset of the parental drug of the sumatriptan is about 20 minutes as compared with the 1 to 2 hours when drug is given by the oral route. Its onset of action took the 1 to 2 hours, but when given parental, 20 minutes are required to produce the effect of the simvastatin, as reducing the pain of the migraine or headache caused by migraine. As I told you, there's fluvastatin has the longest half-life around about 24 to 25 hours. Whereas simvastatin has the shorter half-life in the other rest of the drugs. Related to the precaution of the use of the tryptophan group of the drugs, because they are the serotonin agonist drugs, and serotonin can cause the vasoconstriction of the blood vessels, which can lead to the elevation of the blood pressure or increase the hypertension, and can be cause a cardiac event which had been reported with the tryptophan use. Therefore, these type of the drugs should be used carefully on patient of the cardiovascular disease or patient with the cardiac heart disease, because they increase the blood pressure. Also, tryptophan or type of the drugs are serotonin agonist directly on the coronary vasculature. It can cause the dilatation of the blood vessels. But if the coronary vasculature is damaged or endothelium of the coronary vasculature is damaged, then this agonist drugs can be cause the vasoconstriction, which can further aggravate the cardiac disease or produce the bad effect on to the cardiac patient. There is a other side effect related with the treatment group of the drugs or sumatriptan. All the might include with the sensation of tingling and vomit, dizziness, muscle weakness, neck pain, and pain at the site of the injection. It is related to the sumatriptan because other drugs do not give by the injection, only the sumatriptan available in the injection form. Whereas related to the sumatriptan, it is a shorter duration and it is an expensive drug. Therefore, tryptophan group of the drugs generally They are not used in the patient with the coronary artery disease or angina pectoris disease due to that they can produce the coronary vasospasm. Therefore, treatment group of the drugs should be used with a caution if the patient has a cardiac problem or cardiac disease or hypertension. Whether not tryptophan, L-tryptophan or contraindicated severe hepatic and renal impairment and peripheral vascular disease also. Tryptophan also contraindicated a patient with a peripheral vascular disease, and dolmastine also contraindicated a patient with a cardiac Wolff Parkinson or White syndrome. So this was all about the tryptophan group, which is a 5-hydroxy serotonin agonist drugs. Another group of the drugs, or specific group is ergotamine, which is used for the management of the migraine. It derived from the alkaloid, like the bromocriptine, ergobavine, ergotamine, dihydroxyergotamine, thiamide, methoxy are highly specific for migraine pain. They are not analgesic, although, but they are used for the headache or headache produced by the migraine. Whereas they are not that, because the cause of the migraine is the vasodilatation of the intracranial and extracranial blood vessels. And with ergotamine is a potent vasoconstricting agent, it is used along the migraine also in the case of the gynecological problem, especially the BPH. Available in the form of the oral, sublingual, and rectal inhaler use, where the sublingual form of the ergotamine is more effective. Its onset of action is quicker as compared to the other route of the administration. Absorption of ergotamine increases when it is used with the caffeine. So caffeine increases the absorption from the GIT. Therefore, if it is given with the caffeine, 100 milligram caffeine for each 1 gram of ergotamine can increase the absorption, that increase the, in other words, we can say the efficacy of the drug. Related to the mechanism action of the ergotamine, they take on the several receptor along with the serotonin receptor, and it has a complex action. It acts on the 5-hydroxy receptor or serotonin receptor. It also acts on the alpha receptor, and it also acts on the dopamine receptor. And by acting on these receptors, by alpha agonist activity, by serotonin 1 agonist activity, by dopaminergic activity, they can produce vasoconstriction of cranial arteries by direct action of the smooth vessels also. Vasoconstriction induced by the ergotamine is long-lasting due to the alpha blocking action and cumulative. If we repeatedly give the drugs, the action will be submissive cumulative, and no more than 6 milligram per take or no more than 100 milligram per week should be given to the patient ergotamine, because it has a cumulative effect which can lead to the severe type of the vasoconstriction can be occur, especially in the end arteries area. Reduction of the amplitude of their pulsation that believed to be responsible for relief of the acute migraine attack due to vasoconstriction, and also due to the decrease the pumping or pulsation of the blood. Dihydroxyergotamine can be administered IV or intranasally and has an efficacy similar to sumatriptan. But the use of the dihydroxyergotamine is limited to severe case of the migraine. Common side effect is nausea, but other side effect that can cause the potent vasoconstricting effect. Therefore, their usage should be limited, especially in the cardiac patient, because they can shoot up the blood pressure. They can complicate the cases of the coronary heart diseases. Therefore, side effect of the ergotamine and dihydroxyergotamine is that they can cause the nausea, vomiting, diarrhea, numbness of the fingers and toes can be occur, vaginal pain can be greater. The abortion, if given in the pregnancy, can be due to the uterine contraction. Gangrene to the overdosage can be occur to the severe vasoconstriction of the blood vessels, which can cause the gangrene on the tip of the fingers, tip of the foot toes. It can cause the gangrene of the nose, and also it can cause the gangrene or bowel infarction can be occur with the usage of the high dose of the ergotamine or hydroxyergotamine due to the potent vasoconstricting property. Therefore, ergotamine, they are contraindicated or they should not be used in the patient with the peripheral vascular diseases, patient with the history of the hypertension, or the patient with the cardiac disease. So ergotamine and hydroxychloroquine should be avoided in these type of the patients. And then the group of the drugs, which is under the research, and it is potentially believed by the researcher that this drug, they are the more effective for the management of the migraine because they believe that calcitonin gene-related peptide, which is called the CGRP antagonist, calcitonin gene-related peptide is an important factor for the development or pathogenesis of the migraine because it is a potent, powerful vasodilator. There's an antagonist of this calcitonin gene-related peptide, which are under trial are the Polken-G-Pent and the Telka-G-Pent. These are the drugs called Telka-G-Pent and the Polken. These are the calcitonin gene-related peptide antagonists. Antagonize the effect of the calcitonin gene-related peptide endogenously, which can be have the effective role for the management of the migraine, but they are under the trial and give the good results. The methyl surgery is an ineffective in the treatment of acute episode of the migraine, but prophylactically it can be helpful. But due to the adverse effect, it is not used in the clinical program because chronic use of the or long-term use of this methyl sulfate can cause the retroperitoneal fibroplasia. Side effect of the methyl sulfate retroperitoneal fibroplasia, or they can have subendocardial fibrosis. Therefore, due to these toxic effects, these drugs are not used nowadays clinically for the prophylaxis of the migraine, but they do not have any effect in the acute phase of the migraine. Another group of the drugs which are used, they are the non-steroidal anti-inflammatory drugs like ibuprofen, aspirin, paracetamol. They can be used. Also, opioid group NSAID can be used in acute phase of that, or also they can be used in the prophylactically. There's another group of the opioid group of drugs really used for the management of migraine, but in severe case of the migraine, non-tolerable type of migraine, we can use parenteral opioid drugs, which can be needed. So codeine sometimes used to treat the migraine pain when people cannot tolerate it. The other drugs are contained like the typical ergotamine drugs are contained because the patient patient suffer from the cardiovascular disease and hypertension. Therefore, these drugs are contained. Then we can use the alternative, that is opioid in the severe case of the migraine headache. So NSAID an opioid can be used alternately. Whereas propranolol, as you all know from previous class, it is a prototype of drug of the beta blocker. It is used only the propranolol, Nidolol, atenolol can be used in the treatment of migraine, but preferably propranolol is used for the prophylactically for the management of migraine. It do not produce any effect in the acute phase of the mechanism of is not clear, but it is thought to involve the blockage of the craniovasculature beta receptor that result in the reduced vasodilation, block the catecholamine-induced vasodilation in the brain. That is the proposed mechanism of the use of the beta blockers. Means that centrally catecholamine can cause the vasodilation in some area, which can be prevented by the use of the beta blocker, especially beta 2 receptors. So beta blockers, especially propranolol, can decrease the frequency and severity of the attack of the migraines. Another group of that's a calcium channel blocker. Calcium channel blockers also used for the management of the migraine, but they are used prophylactically for the management of blood because they said that they decreases the tone of the blood vessels, and therefore calcium channel are believed to be helping prevent migraine by interrupting the action of the serotonin on the blood vessels. Like the verapamil, nimodopamine, flunarizine have modest efficacy prophylactic against the migraine, where the flunarizine is a preferred drug among the calcium channel blocker for the prophylactic for the management of the migraine. Another group of the drugs, which is called the antidepressant drugs, all tricyclic antidepressant like the amitriptyline, nortriptyline, they are also often used for the management of the migraine. Along with that, they also affect the level of serotonin and other brain neurotransmitters because tricyclic antidepressant have the anti-serotonin property, have the anti-muscarinic property, have the alpha receptor block property, alpha adrenergic property, anticholinergic property. Therefore, tricyclic antidepressant can be given some result in the management of the migraine, where the serotonin reuptake inhibitors do not show any efficacy in the management of the migraine. This indicates that, this slide showed that serotonin is not the main responsible for the relieving the pain of the migraine, but other effect of the tricyclic like alpha blocking property, anti-muscarinic blocking property, histaminic blocking property, they can be cause of the relieving the pain of the migraine. Therefore, tricyclic antidepressant drugs are useful where the antidepressants SSR or serotonin non-equivalent, they are not effective for the management of the migraine. Whereas another type of the drug that's sedative belong to the group of the sedative hypnotic barbiturate. Butyl barbiturate commonly used in combination with the paracetamol and caffeine or aspirin with the caffeine as a sedative to assist in the management of tension or migraine headache because barbiturate mimic the action of the GABA. Barbiturate mimic the action of the GABA by producing a sedation on the CNS, which can be induce the sleep, decrease the anxiety, decrease the tension, and patient will go for the rest. This can be one of the way of the helpful for cleaning from the relieving from the pain of the headache, where the anti-seizure drugs or anti-epileptic drugs like the valproic, topiramate, gabapentin, taloprevir also used to reduce the frequency of the migraine headache can be used prophylactically, where lamotrigine may be helpful in the migraine with the neurological environment. So anti-seizure drugs maybe decreasing firing rate of the neurons, increase the pain threshold, which can be given in this way, can be given by acting on the sodium receptor, GABA, modifying the GABA receptors and blocking the potassium channels. Another group of drugs also show the efficacy prophylactically in the migraine headache in some patients. Is a baclofen. Baclofen, a GABA mimetic agent, and is an agonist at the GABA B receptors. GABA receptors, they are the inhibitory receptors, inhibitory neurotransmitters of brain. Oral baclofen to be effective in preventing migraine headache in some patients by activating the GABA receptor, especially GABA2 receptor, because GABA is an inhibitory neurotransmitter in the CNS. So baclofen, GABA mimetic drugs can be used prophylactically. There is another type of the drug, is a trazanidine. Trazanidine is a drug which belongs to the group of the skeletal muscle lesion, which is used in the spastic condition and it's effective, but it has been observed that trazanidine or the skeletal muscle relaxant drugs also appear to be effective for the management of chronic migraine pain. So it can be, if we do not get the result from other drugs or poor result from other drugs, we can use safely, because this is a safe drug, safely trazanidine as a skeletal muscle relaxant can be have some efficacy for decreasing the threshold of the or severity of the migraine pain. There is a not commonly used, but it has been observed, experimented that botulinum toxins, which is FDA approved, can be used for the management of chronic migraine headache in the adult, because botulinum toxin inhibit the release of the neurotransmitter, especially the acetylcholine from the nerve endings. Therefore, but usually it is used in the management of the spastic condition, or where there is tone of the skeletal muscle is increased. So, as we know that the skeletal muscle resonance can be given benefit in the management of migraine. So, botulinum toxin also be proved effective for the management of the headache. So, if we summarize along the other drugs, main drugs are for the management of the acute phase of the migraine is ergotamine, dihydroxyergotamine or ergotamine. They are effective for the management of headache. Second one is a triptyline group of the drugs, which is a serotonin antagonist. They are also effective, very effective for the management of the migraine. There's another third type of analgesic group of that, like aspirin, naproxen, ibuprofen. They can be given along with just to minimize the pain threshold effective for the management. Along with that, anti-emetic drugs, like metoclopramide is effective because it inhibits the dopamine receptor, inhibits the serotonin effect on the chemoreceptor trigger zone is effective for the management of the migraine, or it's a part of the treatment or the management of the acute attack of the migraine. So the hydroxyergotamine or ergotamine tryptin group of the drugs and the analgesic along the anti-migraine drugs, they are used in the acute phase of the migraine attack. There is a prophylatically we can use the beta blocker, especially the propranolol, metoprolol, and nidola, but propranolol is preferred. Tricyclic antidepressant, mainly amitriptyline. There is an anticoagulant, mainly topromate, and the calcium channel blocker, verapamil type of the drugs. They are used prophylatically for the management of the acute attack of the symptoms of the migraine. This was, I think, all about the migraine. So, any question? Any question from the participant? Welcome. Any question from the participants? Any question from a participant?
सर
जी हाँ बोलो बेटे.
सर एनसेड जो होते हैं ये तो टेंशन हेडेक के लिए हम यूज करते हैं ना, माइग्रेन के लिए तो नहीं.
बेटे generally non-steroid antiinflammatories they are used. Also corticosteroid has been also given the benefit in the management of the migraine. Generally NSAID they are used for the relieving of the pain because they are in what type of the pain? Either pain occurred due to the headache, pain occurred due to the trauma, pain occurred due to the any injury. We are post-operative, pre-operative, any type of the pain, we can use the NSAID drugs. So in the migraine, it's also produce the pain. The severity of the pain, nature of the pain, and the pattern of pain is different. Therefore, they decrease the pain sensation. Therefore, we use the migraine NSAIDs also in the management of the migraine because headache is a type in which we patient feel the sensation of the pain. Along the cause is different. That it occurs due to the vasodilatation intracranial arteries. Therefore, we prefer the triptane and the ergotamine-like compound, special drugs. But analgesic drugs are non-steroidal, decrease the pain sensation. Therefore, they are used in the acute phase of the pain. On the one hand, they decrease the pain sensation and pain threshold. On the other hand, other drugs can cause the vasoconstriction, like ergotamine and the triptans. Any other video? Video. Hello. Any more question?
Sir, you mentioned that Botox can be used for migraine headaches. So, is Botox taken orally or is that taken in form of injections?
Botox available in form the injection, Botox toxin available, but they are practically not used. Experimentally, it has been observed that Botox toxin is effective. FDA approved this Botox toxin for the management of the, but practically they are not taken because it has also the other adverse effects. Therefore, they are not used more frequently clinically. But they are
you, sir.
in the place of the Botox toxin because Botox toxin, they are the skeletal muscle relaxant. There is we available the tenazepam like group safer drugs which have also the same effect as a skeletal muscle relaxant. Therefore, we prefer these type of the drugs, not the Botox toxin like drugs. Anyone else, बेटे? Anyone else? हाँ बेटे हाथ ऊपर किया तो बताओ, पूछ लो. 198. जोया बेटे खुद ही अपने आप को अनम्यूट करना तो आवाज आएगी मेरे पास। हाँ
सर गलती से हो गया था।
हाँ बेटे 47 बताओ। Any more question? There is no any question.
सर
जी बेटे।
टॉपिक से रिलेटेड तो नहीं है क्वेश्चंस, लेकिन